Pamper Cures brings health information and tips for people looking natural ways to prevent, treat and heal ailments. If that sounds like it could be helpful for you, please join me. To learn more about Pamper Cures, please like, share, and subscribe to my channel to stay informed. Bleeding during pregnancy, cause death of mother or baby. It is necessary to know the early signs of pregnancy so that one can take a proper pregnancy care. A woman has to face and go through with many problems the period of 9 months. In some cases it is very obvious that one may cause bleeding during pregnancy, which it either causes to normal level or dangerous one. So to avoid such risk, one should also add for a pregnancy care tips in daily routine. Early signs of pregnancy are a must to be known by every woman or parents. It is the happiest moment for a woman in her life when she comes to know that she is pregnant. It is very necessary for the couple to take proper decision to become parent. If they plan so, then they should be physically and mentally prepared, because one should take a proper pregnancy care. There are many symptoms or can say signs from which you can come to know. If the woman is not for getting pregnant, then she should follow certain precautions during intercourse, because mentally and physically if she is not prepared, then it may affect the child also. The very early signs of pregnancy which are noticeable are the missing of periods, which is the most important one. They mostly get tired and feel fatigue and also have a morning sickness. The very common signs are the changes of the breast, mood changes and behavior. There are most chances where they find themselves very dizzy, frequent rounds to bathroom, leg cramp and lot more. But the symptoms described above vary from person to person, because it is not necessary that a woman will cause same signs. So to face above causes, then one should definitely take a pregnancy care. To take care, one should follow the pattern of do's and don'ts. The person should avoid drinking alcohol and smoking, drugs which directly affects the baby, working under pressure, eat more and more healthy food, do pregnancy exercise daily, avoid sexual relations which may be recommended by doctor and lot more. It is very common bleeding during pregnancy, so one should not get panic and just deal the situation calmly. If in case you get to see bleeding round your vaginal, you just have to calm yourself and take deep breaths. When you find such kind of bleeding, just give an emergency call to health care or your family doctor. This bleeding mostly appears at the first 3 months of the pregnancy, where you can just see blood spots and then clot around vagina. But if the bleeding during pregnancy occurs on the 28th week, then it is a sign of emergency, because in this period it is the most abnormal situation, as it can cause death of a mother. In other case, if the bleeding occurs, then there are chances of miscarriage of a baby. Either the baby must have been dead in the womb of the mother. A pregnancy care tips are been must for the knowledge of the parents. This 9 months pregnancy period for a woman and a man is very important, and they should take precaution on right time. Firstly, first consult an expert doctor about pregnancy and start the medications. Check out various articles on website where you can get the pregnancy diet and health tip. Include more and more nutrition in food and try to do regular pregnancy exercise. Weekly checkup to doctor and doing stress-free management course is a must. This entire one should include in the list of pregnancy care tips. Disclaimer: the materials and the information contained on Pamper Cures channel are provided for general and educational purposes only and do not constitute any legal, medical or other professional advice on any subject matter. These statements have not been evaluated by the FDA and are not intended to diagnose, treat or cure any disease. Always seek the advice of your physician or another qualified health provider prior to starting any new diet or treatment, and with any questions you may have regarding a medical condition. If you have or suspect that you have a medical problem, promptly contact your health care provider.